Nobody could have failed to notice that at Wednesday's Omicron press conference, Prime Minister Boris Johnson and Chief Medical Officer Chris Whitty were speaking from different hymn sheets on the question of Christmas socialising.
I think that what most people are doing is, and I would think this seems very sensible, is prioritising the social interactions that really matter to them, and to protect those ones, deprioritising ones that matter much less to them. And I think that's going to become increasingly important as we, for example, go into the Christmas period.
Johnson had a pretty different view.
I agree totally with Chris about the response that we're already seeing from everybody, our general instinct to be more cautious. But I said many times that I thought that this Christmas will be considerably better than last Christmas, and I stick to that. We're not cancelling events, we're not closing hospitality, we're not cancelling people's parties or their ability to mix. What we are saying is, think carefully before you go. What kind of an event is it? Are you likely to meet people who are vulnerable? Are you going to meet loads of people you haven't met before? And get a test. And I think that is very, very good at make sure that there's ventilation, wear a mask on transport, and get a test before you go. So we're in a different environment thanks to the boosters from where we were last year. But we've got to be cautious and think about it whilst we wait for the benefits of the boosters really to kick in.
That was Boris Johnson saying, "I agree with Chris," and then going on to say something rather different to what Chris Whitty had said. And the point was made further by Chris Whitty, who was, again, making it quite clear that he was of a slightly different stance to that of Boris Johnson.
I don't have a huge amount to add to what I said previously, which is I do think people should prioritise what matters, and that by definition means deprioritise other things. And I think people are doing that, and I think I would recommend that, and I think most people would recommend that. I don't think you need a medical degree to realise that is a sensible thing to do with an incredibly infectious virus, about which there are quite a lot of key things we don't know.
So Chris Whitty, they're telling people prioritise who you meet with. If it's not an important social engagement, don't do it. Limit the amount you go out. Boris Johnson obviously just saying get a test and open the window. So very, very different. Some Tories thought Chris Whitty overstepped the mark there in giving different advice to that which was announced by the Prime Minister. Joy Morrissey is a junior government minister, so she tweeted, "Perhaps the unelected COVID public health spokesperson should defer to what our elected members of Parliament and the Prime Minister have decided. I know it's difficult to remember, but that's how democracy works. This is not a public health socialist state." If it was a public health socialist state, maybe less people would have died from COVID-19, but that's a slightly different point. She quickly deleted that tweet and she doubled down with a second go. So this was the tweet which replaced the deleted one. "I am increasingly concerned at public health pronouncements made in the media that already seem to exceed or contradict decisions made by our elected representatives. Expert advice is important, but decisions must be made by those we elect who are democratically accountable." The problem there being that Chris Whitty didn't make a decision there. He gave his opinion. He's an independent advisor. He's not a government spokesperson. He's a scientific advisor. Constitutionally, he's supposed to have some independence from the government, and thank God. In the House of Commons, we've got more Tories who are upset. Steve Brine accused advisors of running the show.
Listening last night at the Downing Street press conference, the Prime Minister, I could see why there was no statement to the House, because no new government policy was announced. And then Professor Chris Whitty answered a question from the BBC. And at a stroke, the Chief Medical Officer changed government policy and put this country, certainly hospitality, and Winchester's hospitality bears that out in what I'm hearing, into effective lockdown.
Self-styled Brexit hardman Steve Baker was also complaining.
Isn't it the case that what happens when officials give their advice is it has a massive capacity to herd the public into particular behaviours? So while the government has formally allowed hospitality businesses in particular to stay open, the reality in my constituency is that fantastic businesses like the Old Queen's Head in Penn and Tyler's Green have seen massive cancellations. So what reassurance can you give me that when officials speak, particularly at podiums at press conferences, that they are staying within the bounds of the policy that ministers have decided, and that what ministers have decided takes into account the broad spectrum of collateral harms which follow from, for example, encouraging people not to mix together?
So that was Steve Baker. You're seeing a whole roll call of Tories complaining that not only are the government not following the science, but the scientists are refusing to follow the government. These scientists are not getting in line and saying exactly what we want them to say. They're saying what they genuinely think. What they genuinely think is the truth. They want them to be less honest, essentially. Ash, in this battle between Tory MPs and Chris Whitty, who's going to come out on top?
Well, in a sense, Chris Whitty, because the opinion that he's proffering at that press conference about reducing the amount of social contacts that you have, perhaps not going out in big, crowded, enclosed indoor spaces, and that you just ultimately will have to restrict the amount you're interacting with people in order to drive down transmission rates, that is in line with what the public is already doing. So there is a certain extent to which this discussion is already kind of moot, because before this press conference, you did have cancellations in hospitality, cancelled social plans, people starting to reassess what kind of Christmas they want to have, not because Chris Whitty or Patrick Vallance or Jenny Harries or whoever else it might be is up in the podium scaring the shit out of them. It's because they can see with their own eyes what's going on. So it might be that they have tested positive. It might be that someone they know has tested positive. It might be that several people have had to self-isolate at work. It might be just they take a glance at the news and see day on day a record number of people testing positive, and that doesn't even count reinfections. So I think that when it comes to who's going to have more sway with the public, well, the man who's up there lending scientific credence to what people already know as common sense is already more in tune. What I think is interesting is the impact that these, frankly, right-wing Thatcherite libertarian wackos in the Conservative Party, what impact that might have on Boris Johnson, considering he is in an especially vulnerable position right now. He has hemorrhaged his poll lead because of the cumulative impact of last year's Christmas parties and also Owen Paterson and the corruption revelations. You've seen a bruising by-election loss in North Shropshire, which is following, somewhat hot in the heels of Chesham and Amersham. And you've also got that big rebellion of Tory backbenchers on the Plan B measures. So Boris Johnson, might be swayed not by the strength of the arguments being put out by Steve Baker or Joy Morrissey or Steve Bryan or whoever else it might be, because these are actually very poorly thought arguments. If you're worried about hospitality and you're worried about the impact of cancellations, just vote through an economic support package for affected businesses. That's quite simple. But Boris Johnson might make a political calculation in terms of what happens next. Does Christmas go ahead as planned with unlimited household mixing? Do hospitality venues remain open, next week, through the week after, into the new year? What happens if hospitalizations and deaths start increasing in line with these record number of positive test results that we're seeing? Now, the vulnerability of his political position might be that he finds himself drawn to the short-term option of shoring up backbench support at the expense, of course, of people's lives, public health, and that might be the longer-term, more fatal wound. It makes him look incompetent, uncaring, unfeeling, and sort of lays the groundwork for a competitor and a Tory leadership candidate.
I agree with you that Chris Whitty is going to come out on top of this, not only, as you say, because his advice fits with the lived experience of everyone in the country right now, which is everyone left, right and centre is going down with Omicron. I don't think anyone really feels like going to Christmas party now, but also because he's become quite assertive, actually. So he gave evidence to the Commons Health and Social Care Committee this week, where Dean Russell MP asked whether his advice prioritised COVID over cancer. Whitty didn't hold back.
One of the other comments that I've heard is that people are concerned that we're prioritising COVID over other things, and especially with the Omicron variant. COVID over cancer, COVID over other serious issues. What would you say to that?
Yeah, I think this is sometimes said by people who have no understanding of health at all, but I don't think it's said by anyone who's serious, if I'm honest. And when they say it, it's usually because they want to make a political point. The reality is, and if you ask any doctor working in any part of the system, they will say this, that what is threatening our ability to do cancer, what is threatening our ability to do all these things, is the fact that so much of the NHS effort, so many of the beds are having to be put over to COVID, and that we're having to work in a less efficient way because COVID is there. The idea that the lockdowns cause the problems of things like cancer is a complete inversion of reality. If we had not had the lockdowns, the whole system would have been in deep, deep trouble, and the impact on things like heart attacks and strokes and all the other things people must still come forward for when they have them would have been even worse than it was. So I do want, through all of you, to make absolutely clear that's an inversion of reality.
This is sometimes said by people who have no idea what they're talking about. I really love that as a reply. Obviously, the point you make is incredibly important. There are arguments against lockdowns and restrictions. They do have an effect on mental health. They do have an effect on children's educations, our ability to socialize. But they don't cause more cancer to go untreated or more heart attacks to go untreated, because the whole point is a lockdown is precisely to stop hospitals being overwhelmed. Hospitals didn't prioritize COVID over other illnesses. They were forced to treat people for COVID because they were people who were quite close to death. And the lockdown, back then was the only way to stop them being completely overwhelmed. So they might have time to treat people for cancer or other urgent illnesses. On the issue of the public not really buying the Tory line on many of these issues, Minister Chris Philp got a rough ride on Question Time last night.
The Prime Minister said people should think carefully before you go to pubs and restaurants, but absolutely said don't cancel parties. Chris Whitty said don't mix with people you don't have to for either work or family things that really matter to you.
Yeah, look, the messaging is the same, which is be cautious and exercise judgment. It's pretty clear.
So why do you think people are laughing at you saying that? That the messaging is the same? I mean, why do you think people are laughing?
You can try and pass the language, but the fundamental point is people can exercise their judgment, but just be cautious.
Well, if it's not about language and what people say, what is it about? Okay, there's lots of people laughing. Let's hear from some of them. The man in the purple sweater.
People are laughing because you're clowns. You said the minimum sensible measure twice, and 100 of your MPs voted against it. What does that say about them? Is that not a mixed message? Going into Parliament without masks, is that not a mixed message? You had to be told to put masks on. What do? We see that. We see you as the Christmas party. You're clowns. That's it.
Yeah, well, if you walk into Parliament yesterday, you would have seen...
Ash, did you feel sorry for Chris Philp there? I suppose he didn't make the policy.
No, you know what? I feel thankful for Chris Philp because he perfectly embodied one of my favorite political TV tropes in the world. And that is when a member of the public is just ripping you to shreds in front of your face, telling you you're a prick, your mum's a prick, your hair's stupid. And you just have to nod like I'm really hearing you right now. And I love seeing politicians backed into that corner because you can also see their mind go totally blank. It's like a trauma response, like a freeze response of, I just can't fully engage with what's happening right now. I just have to keep nodding. I love it. I love it. I love you, Chris Philp, for nodding so inanely as that man tore you to shreds.